"How are you doing?" was the first thing that the American Lung Association said to me when I called them. I became my mom's primary caretaker at the age of 23. I can still remember the exact words that my mom said when she was told she had lung cancer. She immediately started sobbing and said, "Am I going to die?"
We are here for people usually when they don't hear good news. When an individual experiences lung cancer, usually when they're talking with their doctor, they might not understand what that doctor is saying because they just were told some devastating news. So once they are able to reflect a little bit what's happening, that's when they need help. And we're here to listen, and we're here to help them through what they're going through the best that we can.
Statistically, lung cancer is the #1 killer of both men and women in the US. Within 3 months, my mom actually passed away. It was very quick, very sudden, very unexpected, and it's very common within people with stage 4 lung cancer for it to take them very, very quickly.
The American Lung Association's mission is to prevent lung disease and to promote lung health. We do this through education, advocacy, services, and our research programs. We provide education in multiple ways. It can either be helping expectant mothers come up with the tools and the education to quit smoking. It can also be to educate the people here in Missouri about our air quality and how, as a state, we're failing. Through our advocacy efforts, we work with legislators to really pass smoke-free air laws and protect the laws that are already set to make sure that we can continue to improve the air that we breathe, whether that's internal air or external air.
I called the American Lung Association Lung Helpline, and the person that I talked to immediately asked about me. And having somebody ask about me as a caretaker just meant the world to me. Getting to get those feelings and emotions out in a healthy manner really helped me get through the situation that I was in. And they really just helped me be the best caretaker for my mom that I could be in the very short time that we still had with her.
The tangible way Missourians see the American Lung Association is through our programs and services, whether that is helping a workforce provide smoking cessation programs to their employees, when it's working with expectant mothers, when it's doing home visits, to where a small child may have asthma and be able to look at their home to find out what is triggering that child's asthma. We offer programs and services, we offer education, but we know if we want to cure this disease, it will need to come from research.
We continue to study many approaches, not knowing which one will or won't be the next great breakthrough. Some investigations lead to therapies that change lives tremendously. Some teach us that our approach was not the best of ideas and wasn't effective. The only way to understand where the great breakthroughs are going to come from is to do large, well-constructed, well-designed, well-executed studies in order to truly understand that we have identified a life-changing therapy.
We're so close in making some major breakthroughs when it comes to how we look at lung cancer and overall lung health. And that's why we need everyone's support more than ever before so we can continue this fight.
These studies are designed to include patients of all age groups, of all genders, and across the country. So the benefits can be extremely wide and impact most patients with the disorders of interest.
People should donate to the American Lung Association because they truly do change lives in so many ways. They changed mine just from a phone call. They've changed others by funding research and working for clean air and for tobacco cessation programs, and they just do so much to help people breathe better.
When you donate to the American Lung Association, 90 cents of every dollar goes towards our mission, and that mission is directly impacting people's lives.
So the person that I am now is drastically different from the person that I was 5 years ago when my mom was diagnosed with lung cancer and when I went through this experience. I'm a much happier person. I'm a much more confident person. I actually live in the house that my mom grew up in, and that kind of helps me keep my mom's memory alive and feel connected to her. I have a tattoo of my mom's actual handwriting. She wrote that when she was on life support and she couldn't talk, and it says heart all, and that was my mom's way of saying that she loved us all. If there was a cure to lung cancer, it would make me the happiest person in the entire world. It's all that I talk about. I would love to spend as much time as I can paying it forward to the American Lung Association.
Now more than ever, we need your help in the fight against lung disease. Whether that's through financial support or through volunteering, we can't do this alone. Because when you can't breathe, nothing else matters.